Okay.
Alright, today I'm going to be doing a diabetic foot exam. First I'm going to talk to the patient and ask them what their last blood sugar was, about their A1C, ask them if they're having any problems with their foot, tingling, any pain, aching, cramps, that's looking for claudation or anything like that, or any kind of ulcers that could be forming. Ask if they've had any injuries. Also need to see when their last exam was, because it could be different times throughout the process of their disease. I'm going to look and inspect the skin. I'm going to look for deformities such as hammer toes, bunions, anything like that. I don't see any obvious hammer toes or bunions. Those can rub against the shoes and cause ulcers. I'm going to check for the flexion of the foot, see if it goes past 90 degrees. I'm going to check the strength of the foot, push your foot against my hand. That checks to see if there's any weaknesses. It could also check for pressure points at the same time. I'm going to look at the plantar flexion of the foot, see if any of the metatarsal heads are lower than the other. I don't see any obvious signs of that. That can create more pressure points, and also rub on shoes if they're ill-fitting or anything like that, and cause ulcers. I'm going to look for chair rot, and that is when you have neuropathy already, it can fold in like the rocker bottom of a chair, and it doesn't hurt or anything because they have neuropathy, and this arch is rather low, but it is not bowing out, so it would not be a chair rot. Next, I'm going to look at the skin, see if it's dry, cracked, anything like that. Does your skin ever, on your feet ever itch or anything like that? It's not itchy. That can be a sign of athlete's foot, which is a fungus, which is also hard to cure on diabetic people. I'm going to look at the bottoms of the feet, see if there's any cracks or calluses. Calluses can be the precursor to ulcers. Then I'm going to look at the pulses. I'm going to palpate them and see if the circulation's good. I'm going to do the dorsalis pedis, and it's good. I'm going to do the posterior tibial, and it's good. Just making sure that the circulation's good, so that would be a sign of neuropathy if the circulation wasn't as good. I'm going to look at the nails, see if they're thick, and they're not. I'm going to look for ingrown toenails or signs of those. If there's calluses, such as these around the foot, that is the first sign of ingrown toenails, and that is on that foot. Then I'm going to look at the temperature, see if it's the same throughout. It is. I'd also need to inspect the other foot too to make sure they're the same temperatures. I'm going to test the capillary refill on the toes to make sure the circulation is good. And then I'm going to use some other tools to test. I'm going to do the reflex testing on the knee to make sure it's good, and then the back of the ankle, and it's good. Over time, the reflexes can deteriorate, which can also lead to other injuries. I'm going to test with the monofilament that's on the reflex hammer, and it tests the sensation. You need sensation in your foot so you don't step on anything, scratch your foot, or anything like that. So I want you to close your eyes, and I'm going to poke your foot, and you tell me if you feel it. You feel it?
Mm-hmm.
Okay.
Yep. Yep. Mm-hmm.
Okay, so sensation is good. I'm also going to test with a Q-tip to see if they can distinguish between sharp and dull. I'm going to rub this on your foot, and you tell me if it's sharp or dull.
Sharp.
Sharp? Okay. How about now?
Dull.
Dull. Okay. Then I'm going to test with the tuning fork. This also tests for sensation. Tell me when you stop feeling the vibration.
really feel it no more.
You don't feel it? Okay. So if he doesn't feel it and my hand still feels it, that would be a sign of neuropathy because they're not feeling sensation. I need to teach them to examine their feet daily when they take their shoes off to see if there's any obvious signs of calluses forming or ulcers forming, any scratches, anything they may have stepped on or anything in their shoe that they might not have felt. I need to teach them when they need to have these exams. If they have a normal exam, every year is fine. If they have any signs of neuropathy, like the poor circulation or not feeling the sensation test that we did, I would recommend every 6 months. If they have ever had any previous ulcers, they need to do it quarterly. And then if they have a current ulcer, they need to have it done every 2 months and maybe even more often.